Is it fibromyalgia or is it rheumatoid arthritis that's causing your pain? Hello, this is Dr. Siddharth Amber, specialist in rheumatology and in regenerative medicine. An occasional question and diagnostic dilemma that comes up is determining whether an individual's pain is rheumatoid arthritis or fibromyalgia. This is something that I also see on a lot of patient message boards where they're wondering why they weren't diagnosed with rheumatoid arthritis but rather with fibromyalgia. In a lot of ways, it makes sense why people might confuse the two. And the reason why is because while these are two distinct diagnoses, the experience of pain can sometimes be very similar in that a lot of times people may have generalized pains in rheumatoid arthritis, and that certainly is how fibromyalgia presents as well. Inflammation can feel like different things to people, but a sensation of swelling, generalized pains, and stiffness are very common symptoms that you hear in both of these diagnoses. In reality, these are two very distinct diagnoses, however. Rheumatoid arthritis is a condition where your immune system is being overly active and miscommunicating and attacking your own joints, leading to pain and swelling in a lot of joints, significant inflammation on labs and imaging, as well as on examination, and symptoms that lead to dramatic stiffness in the morning and worse pains with inactivity and first thing in the morning. Fibromyalgia, on the other hand, is a condition, don't fully understand what's causing it. However, the symptoms are generally widespread muscle pains rather than specifically joint pains, significant tender points on examination as well, and really significant fatigue symptoms as well. Fatigue that is also not really improved with a good night's sleep. That's called non-restorative sleep. So there is some crossover in terms of symptoms as patients describe them, but objectively from a physician end, these are very different conditions. And in fact, not only is the diagnosis differently, but in determining if someone has active disease is very different. In rheumatoid arthritis, telling if someone has active disease, you should see signs of inflammation on labs, on examination, and certainly imaging. For me, diagnostic musculoskeletal ultrasound is a great way of determining whether somebody has active inflammation and is one way that I do differentiate between rheumatoid arthritis and other diagnoses. Another confounding variable in this is that individuals with rheumatoid arthritis can also have fibromyalgia, in which case it becomes the responsibility of the rheumatologist to determine whether your significant symptoms at that moment are more from your RA or from your fibromyalgia. The key ways to tell are if there's objective evidence of inflammation. Again, whether that's examination, ultrasound, or labs. That's the key, objective signs of inflammation. And that's really how you differentiate between these two diagnoses.